Being a vast democratic country, it is a gigantic challenge for India to set up a better healthcare system. About 70% of the population live in rural areas, and the government is constantly striving to provide primary health services. There is a massive difference in quality between rural and urban healthcare, even between private and public health services. It is recommended by World Health Organization that one doctor should be available for every 1,000 patients. But the actual scenario is different. Currently, a doctor is treating more than 1,700 patients as per studies available over the public domain. Someone who becomes ill or suffering from an accident can choose between the option of a government-run hospital or private health facility, though it is possible to receive the best health service from there, but that is very expensive. A person from a remote area or hard terrain is technically unable to get such health service at an affordable price. If they need to go for such treatment, who will compensate for loss of earning? Or who will feed the family?
हामी चाहिँ यहाँ है डिस्ट्रिक्ट हस्पिटल जानु पर्दाखेरि चाहिँ है हामीलाई धेरै टाढो परेको कारणले हामीले है गाडी भाडाहरू धेरै बियर गर्नुपर्छ र यहाँदेखि गाडी पनि बिहान गएपछि है बेलुकासम्म पर्खेर बस्नुपर्छ एमर्जेन्सी जानु पर्यो भने गाडी रिजर्भ लानुपर्छ हामीले धेरै खर्च हुन्छ.
It is difficult to focus on all problems simultaneously, but Bhavishya Bharat is trying to minimize the burden to some extent. With the support of State Bank of India Foundation, Bhavishya Bharat is running a clinic on wheels in 25 remote villages of Namchi block in South District of Sikkim through Project Sanjeevani. More than 12,000 population is being covered through primary healthcare services at their doorsteps. Project Sanjeevani is an effort to reduce the treatment cost that this deprived community spent on any primary health issue. Bhavishya Bharat is providing doctors' consultation, medicine and basic pathology services to people along with spreading awareness to prevent various health issues.
तर भविष्य भारत आएदेखि हामीले है त्यो सानो सानो कुराको लागि यो पैसाहरू है हामीले तिर्न परेको छैन र यो सबै कुराको सुविधा यही भएको कारणले चाहिँ हामी फेरि पनि भविष्य भारत है एनजीओलाई यहाँ फेरि पनि रेगुलरली आइदिने हामी डिमान्ड पनि गर्दछौँ.
Bhavishya Bharat is aimed to ensure early detection of ailments in its primary stage, so the people can avoid the high cost of treatment of secondary or tertiary healthcare.
We have our engagement with Bhavishya Bharat and South Sikkim Namchi District Hospital, where these services were launched to provide basic healthcare services to the people of South Sikkim districts. So far, the service has been launched in 25 remote villages and 25,000 people have been taken benefit of this scheme. We have conducted 15 health camps and 488 awareness camps. So with providing of these basic healthcare services in the remote locations, this initiative has become quite handy and helpful to the rural population, and they have been benefited a lot, and where our partnering organization Bhavishya Bharat has played a major role. So we thank their team at the ground for the great support to the rural communities during the difficult time of COVID. And we hope that such type of ventures will further escalate it to remote and different locations of the country.
In this pandemic situation, the medical team has taken extra care to manage this deadly disease as an active member of COVID-19 task force formed by the government of Sikkim. Thus, this collaboration with SBI Foundation is making primary healthcare available, accessible and affordable to many underprivileged communities through Sanjeevani.